Basic neurology. Um, you will be seeing a lot of ultrasound machines, and there will be a lot of different brands of ultrasound machines by using which of you will be practicing a lot of regional blocks for different kind of pain procedures. And but usually all of them have the same kind of keyboard. So same kind of keyboard, or they have some common features in the keyboard. So like for example, the gain, depth, freeze button, color Doppler, and the frequency. So gain button is the knob is basically used, you can say, as alternative to the brightness of your screen. You want it bright or you want it dark, you can just increase or decrease the gain. Then there is depth. Depth means you want to zoom in or zoom out your image. So you can use the depth. And freeze. And sometimes also when the structure is very deep, you can increase the depth to locate your structure. Freeze, you want to freeze the screen and to demonstrate the sort of anatomy on the screen to others. And sometimes you just save it. And then color Doppler, when you are in doubt, you use color Doppler. You just switch on the color flow, and then if the structure on the screen got some colors in it like red or blue, that means that it is a vessel. It's just to remove your doubt or make sure that you're not gonna prick or pierce the nerve, pierce the artery or the vein. So just avoid that, you can use a color Doppler to make sure. Now the different kind of probes. You have phased array probe, you have curvilinear probe, and you have the linear probe. The curvilinear probe and the linear probe mostly are used for the nerve blocks, the regional anesthesia. So the curvilinear probe is used for the deeper structures. As you can see the depth here, it can go to like 30 centimeter depth, while the linear probe's depth is less. So this is used for the superficial structures, and the structures name are given on the bottom of the slide. Arteries, veins, skin, musculoskeletal, testicles, eyes, and breast. And about the frequency, now the latest linear probes have more than 10 megahertz frequency. It's up to the 13 megahertz frequency. Now, starting the anatomy of the lower limb before going to the sonoanatomy. There are three compartments of the thigh: anterior, posterior, and the medial thigh, a medial compartment. Anterior compartment is of extensors of the knee. Posterior compartment is the flexors of the knee, and medial compartment is the adductor of the knee. As the name showing here, femoral nerve is the main nerve of the anterior compartment of the thigh, and the sciatic nerve is the main nerve of the posterior compartment of the thigh, and then there is the obturator nerve is the main nerve for the medial compartment of the thigh. These are contents of the anterior facial compartments of the thigh, means the muscles on the anterior thigh. The most important and most prominent ones are psoas muscle, iliacus muscle, and sartorius. And then there are the cords. Cords have vastus lateralis, rectus femoris, vastus intermedius, and vastus medialis. You will be having encounters with these muscles, iliacus muscle and psoas muscle, also called iliopsoas. Over here, this is iliacus and this is a psoas. Both are known as iliopsoas muscle. So you will be having a lot of encounter with these two muscles, because most of the whenever you will be performing a block on the upper part of the anterior thigh. And now I will zoom in for you. Zooming in is here. So I'm zooming in the upper anterior compartment for you. This is the iliacus muscle, this is a psoas. Main thing is you can see their origin here, and their insertion is in the femur, the upper part of the femur. So these are very important muscles, and covered by the fascia iliaca. And as you can see, this is anterior superior iliac spine, and over here there is anterior inferior iliac spine, and inguinal ligament is stretching between this and pubic tubercle. So, and your nerves, the artery and veins usually lie here. Now, the posterior compartment, this is the gluteus muscle. Over here, the semitendinous and semimembranous muscles. Over here is the biceps femoris muscle. This whole posterior part of the thigh, hip, thigh, and the lower leg is supplied by the sciatic nerve. Now, removing the gluteus muscle, we will have this muscle, we will have, we will be having piriformis muscle here. So this is sciatic nerves coming out just below the piriformis muscle, and it will travel down in the leg, and it will divide into two main branches, tibial nerve and the common peroneal nerve. That will further supply the part of the knee and then goes down to supply the lower leg and the feet. Nerve plexus of the lower limb. So there are two plexus nerve. First is a lumbar plexus, and the second is the sacral plexus. So the lumbar plexus is formed by the L1, 2, 3, 4 ventral rami of these nerve roots, and the sacral plexus is formed by the lumbosacral trunk, that is formed by L4, L5, and S1, 2, 3, and 4. So the nerve of the very important nerves arise from the. So very important nerves arise from here and supply the anterior, lateral, and medial side of the thigh. Lateral cutaneous nerve is the nerve for the lateral side of the thigh. Femoral is for anterior, and obturator is for the medial side. Now, the sacral plexus has a very important nerve, that is a sciatic nerve, then which divides into common peroneal and tibial nerve. And then there are some other nerves. We will be discussing these nerves and this nerve. So this is a brief summary. Anterior side and posterior side of the leg. The lateral femoral cutaneous nerve, as you can see, is coming out, and it's coursing down to the lateral side of the thigh. Supply here, femoral nerves coming down beneath the inguinal nerve and inguinal ligament, and it supplies the anterior side, and then gives off branch, that is saphenous nerve is the cutaneous branch of it, and then it supplies the medial side of the leg. Obturator nerves coming over here on the medial side supplies the medial side. This is the posterior side. Whole posterior side is supplied by the sciatic nerve, and then the lower leg is supplied by the branches of the sciatic nerve. Now, nerve blocks and their sonoanatomy. Femoral nerve innervation is a nerve root is L234, and as you can see, the area supplied by the femoral nerve is this. The anterior side of the thigh, the knee, and the medial side of the leg up to the foot, but not the big toe. And it has a supply. It supplies these cords muscle over here. The bony part is the part of the hip joint, and then the femur, anterior side of the femur. So these are the indications of the femoral nerve. You can have a screenshot of it, make a picture. Femoral nerve. Now, when you place your probe here, actually your probe lies here, over here. So this is the area, the iliacus muscle, the psoas muscle on this side, the vein, artery, and nerve, vein, artery, and nerve, and you see this under the probe. Okay? This under the probe, the iliacus muscle, vein, artery, and nerve, and your probe is here, and your needle will come from this side, and you will give your drug over here. Now the lateral femoral cutaneous nerve. As the name lateral femoral cutaneous nerve, it is just the cutaneous supply of the lateral side of the thigh, and no motor and no osseous or the bony supply. These are some indications of the lateral femoral cutaneous nerve. Now, when you put your probe here, actually, what's underneath? Okay, what's underneath is you put your probe here, and underneath is again the most famous muscle is iliacus muscle, and over here is the sartorius, as I have told you, and then this is fascia lata. All these make a facial sheath, or you can say the facial space compartment looks like an eye, in which there is lateral femoral cutaneous nerve. So your probe lies here. You place your probe here, and this what you get underneath your probe. Sartorius muscle on one side, tensor fascia lata on one side, and then this is the LFCN. This is LFCN, the eye, the famous eye, and this is the nerve, and we're injecting the drug over here. And these are two muscles, tensor fascia lata and sartorius, tensor fascia lata and sartorius. Adductor canal. It is saphenous nerve basically is blocked here, which its nerve root is L34. And as you can see, it's the cutaneous ply over here. It gives some branch. It has sensory supply on the medial side, but it gives a little few branches to the knee, a part of the knee over here. So this is adductor canal, sartorius muscle over here. There's adductor longus magnus and then vastus medialis. We have femoral artery, vein, and saphenous nerves in the adductor canal, the contents of the adductor canal. So when you put your probe, basically you're putting your probe over here, and then you will get this sartorius muscle. This is adductor magnus, adductor longus, and this is the vastus medialis. This is saphenous nerve. And all these lies in one sheath. When you give your drug here, it spreads all around here. This is sononanatomy. So this is, as you can see, this is artery and nerve. And when we are injecting the drug, you can see clearly this is a local anesthetic and this is the nerve. Now the sciatic nerve at the popliteal fossa, it supplies this part, the lateral part of the leg, of the lower leg, and the whole, the dorsum of the feet and the sole of the feet. And then you can see it's motor supply, and this is the osseous or the bony supply. Indications of sciatic nerve block below the, at the level of the popliteal fossa. So the probe position, and this is what you will get. On one side, there will be biceps femoris. On the other side, there will be semi-membranous and semi-tendinous. And then you will be having two components of the sciatic nerve, that is common peroneal nerve and tibial nerve. And these are the popliteal artery and popliteal vein. So when you start injecting the drug, these will surround with the local anesthetic and they will get separated. So this is the artery. And as soon as we started injecting the drug, you will see the separation of the two components over here. These are two components. Let me show you again. These are getting separated. Fascia iliaca block. This is very important. Okay, now we have been discussing the nerve blocks. Now we are going to discuss two fascial blocks. This is one is sci-fi, that is the suprainguinal fascia iliaca block. So it involves the injecting local anesthetic into the space beneath the fascia iliaca, targeting nerves that lie within the facial plane: femoral nerve, lateral femoral cutaneous nerve, and the obturator nerve. So when we block all these three nerves, so it will block the lateral side, the anterior side, and also the medial side. All right, the medial side of the thigh. So it will so it will block the sensory supply of the hip joint as well as the anterior thigh, medial and lateral part of the thigh, and the knee. This is how you will place your probe. Okay, now when you place your probe here, actually you're placing your probe over here. Look again, you're placing your probe here over just near the anterior inferior iliac spine, over here. And what is this? This is the fascia iliaca that is covering the psoas muscle and the iliacus muscle, and it's going down beneath and below the behind the inguinal ligament. And it also has different nerves, different nerves passing underneath it. This is the lateral femoral cutaneous nerve on the lateral side. This is the femoral nerve, and over here we will be having, over this side we will be having obturator nerve. So when you inject your drug here, it spreads underneath the fascia, and it just numbs all three nerves, as I mentioned. So this is basically sononanatomy. You will get the iliopsoas over here. This is internal oblique. This is sartorius. These are the circumflex vessels, and you have to identify them, and you will inject your drug here, and the fascia will start separating. Now the PANG block, very important one, that is pericapsular nerve group block, and its innervation is, it innervates just, it blocks the nerve that supply this part, only the hip joint. Facial block, as it involves injecting local anesthetic into the facial plane between the psoas tendon and the ilium, targeting the articular branches of the nerves that supply the hip joint cap. So those are femoral, obturator, and accessory obturator nerve. So this is where you will place your probe and you will get this. Now, where are you placing your probe? You're placing your probe over here. You will have again the iliac muscle and the psoas muscle. I have already mentioned these are very important muscles because you will encounter them everywhere on the upper anterior compartment. So these are the nerves coming out beneath there. This is the rim of the ilium. So when you will inject your drug over here, just near the psoas muscle, like this is the needle injecting the drug. It will cover all the muscle, all the nerves coming out beneath the tendon and over the rim of the ilium, like this again, as you can see. So this is basically the rim between the anterior inferior iliac spine and IPE. And this is the iliopsoas tendon, this is iliacus, giving the drug here beneath this, and it will start rising and start spreading, and it will numb all the nerves. This is another picture sonographic demonstration of the PENG. This is the this is iliacus muscle. This is iliopsoas tendon. This is the ilium, the AIS to IPE cortex. This is femoral artery vein. This is nerve. So you will be coming from here in this direction, just touching the bone. You will deposit the drug, and it will spread all over the rim, and it will numb all the nerves. These are some indication and of the blocks. These are contraindications. This is just general contraindications: patient refuse, infection, inflammation over the area, allergy to the drug, certain skin conditions. Femoral nerve block have some specific contraindication like septic arthritis of the hip joint or previous femoral bypass surgery. So that's all. Thank you so much.